Are hospitals or clinics able to accurately determine whether or not a person is mentally ill, and to what extent? Let's say you have a minor psychological disorder and the doctor diagnoses it as schizophrenia and says that you will never fully recover. However, you don't even have such a disease. How would you feel after this diagnosis? Would you be able to go back to your normal life? I think this and similar diagnoses would affect us in every way for the rest of our lives. In order to test how accurate such diagnoses are and whether the system works correctly, David Rosenhan, professor of psychology at Stanford University, not only asked himself the question we asked at the beginning, but also conducted one of the most shocking experiments in the history of psychiatry, the Rosenhan experiment, also known as the PAT experiment. The year was 1969. A team of 8 people, including Rosenhan, 3 psychologists, a psychiatrist, a student, a pedagogue, a housewife, and a painter, went to one of the professional clinics in the United States, claiming to hear voices in the void. In fact, none of the 8 had ever had a psychological disorder in their lives and were specially selected for the experiment. The basis of the Rosenhan experiment was this. When this group of 8 people went to the clinic, they were to tell the doctors that they were hearing sounds like emptiness and futility and that they were very disturbed by it. These words specifically chosen by Dr. Rosenhan to signal an existential crisis. Then, if they were admitted for treatment, they would immediately act normal and try to convince the doctors that all the symptoms were gone. In this way, the awareness of the professional psychiatrists would be tested, and how accurately they assessed the patient's condition would be observed. The point is that shortly after the hospitalization was completed, when the patient started to say that the voices had completely disappeared and that he was feeling much better, the hospital staff did not take this statement seriously because they thought that it was not possible for a patient to have recovered in such a short period of time. So after 7 of the group were diagnosed with schizophrenia and 1 with manic depressive psychosis, they were all hospitalized. From the day they were admitted to the clinic, the team members were discharged from the clinic in 7 days at the shortest and 52 days at the longest, even though the subjects showed no symptoms and denied being ill. That alone shows that a lot of things didn't go right at that time. But this is just the beginning. During their hospitalization, they were given intensive treatment medication and asked to take it regularly, and the subjects would pretend to take the medication but would always pour it down a toilet or something. Another part of the plan was that all the subjects who were soon discharged would go to another clinic to repeat the role and make the research more thorough. In total, none of the 12 clinics realized that the incoming patients were fake patients and hospitalized them after a few questions. So this experiment continues in this way for 3 weeks. Psychiatrists, unaware of the experiment, even discharged the fake patients from the clinic with a diagnosis of schizophrenia in remission. According to Rosenhan, this diagnosis shows that mental illnesses are not seen as curable because having schizophrenia in remission does not mean you are sane. No one sees a cured cancer patient as defective, while a single complaint of hearing various voices can leave a patient with a label that sticks with them for the rest of their lives. After Rosenhan wrote about all this in his studies and made the results public, it was as if a bomb had dropped on the world of psychiatry. Clinics across the country refused to accept the results of the experiment and said that they would never make such mistakes like other hospitals. One hospital administration even contacted David Rosenhan and challenged him to send lying patients to their hospital without prior notice. Of course, Rosenhan accepts this challenge. When I was doing the research, I thought, like many people, that this hospital would be more careful than the previous ones, and at least the result would be more acceptable. But the result is even worse than before. Over a 3-month period, the hospital team considers 41 of the 193 patients admitted to the hospital to be pseudo-patients. They also suspect 42 others. In fact, at least 1 psychiatrist and 1 other hospital staff member agreed that 19 of these 41 patients were mentally healthy. Hold on tight. because Rosenhan is embarrassing the psychiatric world with this second study. He actually does not send a single lying patient to the hospital during this 3-month period. From now on, the world of psychiatry has surrendered to Rosenhan, and trust in hospitals has been shaken. It is obvious that in psychiatric clinics, we cannot distinguish between the mentally healthy and the mentally unhealthy, Rosenhan said. Were the 19 people who more than 2 psychiatrists considered normal and labeled as fake patients really normal or mentally ill? I think we will never know, he adds. The most interesting part of this is that in the first study, the group of 8 people who were admitted to the hospital with a diagnosis of being sick, some of the real patients in the hospital at the time saw them as fake patients. To be precise, 35 of the 118 real patients in the clinics at the time said to some members of the group of 8, "You can't be crazy, you're probably a journalist or a professor who came to inspect the hospital," while the rest of the patients believed that these people had been sick before and were now recovering. Can you imagine? Real patients realize what doctors don't realize. Rosenhan's experiment, which ultimately stranded dozens of clinics and hundreds of psychiatrists across the country, played an important role in the development of medicine and psychiatric practice. Today, the results of this experiment have laid a solid foundation for more effective interventions, more humane treatment, and more accurate diagnoses. So far, we have talked about the experiment and its results. Yes, it is a very interesting experiment, and one that caused an earthquake in the world of psychology. However, even though some parts of the experiment are still being discussed and researched years later, the results do not reach everyone. So, while the visible part of an event is of great interest, the invisible parts don't interest most people. So, let's talk about what we mean by the invisible parts. This book, The Great Pretender, by Susanna Cahalan, is about the famous research of David Rosenhan, who died in 2012. The purpose of the book is to find out who the subjects were and what exactly happened in the experiment. Susanna Cahalan takes the documents from Dr. Rosenhan's experiment and examines them meticulously. The results of her research are quite disturbing. For example, when Cahalan analyzed all the records of the experiment, she was able to identify only 2 of the original 8 fake patients. One of them was Rosenhan himself, and the other was one of his medical students named Henry. The occupations and genders of the other 6 appeared to have been established, but their true identities were not. Cahalan suspects that they may have been fabricated by Rosenhan. During his research, he learns that one of the 9 fake patients who were initially told to participate in the experiment was not really sick. However, this person received good care and was not mistreated in the hospital, where he was admitted with faked symptoms. This did not match the narrative of Rosenhan's experience, so he excluded this person from the experiment. He also notes that his research does not include all perspectives on experiments. For example, let's say that one day you drank fake blood and went to the hospital in an emergency. There, you play the role of having blood coming out of your mouth and make the doctors believe it. Would they let you go immediately? Never. First of all, they would examine you and watch you. Even if you say, "I'm fine, I want to go home," from that moment on you are the responsibility of the doctors, because if this really happened, and if anything happens after the request for help, the hospital will be held accountable. Of course, this example does not justify wrongly treating a person who is not really sick for 52 days, but it does illustrate that any hospital would not discharge a patient immediately, even if they wanted to. Moreover, in Rosenhan's time, these hospitals were discharging someone once diagnosed, saying that they would never recover and that they were in schizophrenia remission. This was very uncomfortable even for the real patient who had fully recovered. Today we have come to a time when many psychological illnesses can be completely cured and the patient can permanently resume a normal life. Even though we may think we are physically and psychologically strong, given the challenging conditions of our current times, the stress we face, the problems we encounter, and the spread of uncertain illnesses, everyone should consult with psychologists and doctors as much as possible to proactively address potential issues.